Focus on the idea of addiction, how you battle this ailment. So we welcome Dr. Shimi Kang on the show to tackle this, and you've got extensive experience on this topic. We were talking during the break, the idea of having a habit versus an addiction. How do you, to start, how do we make that differentiation?
Sure. A quick way I tell my patients and families is something called the 4 C's. So if your use of drugs and alcohol crosses into these 4 C's, you know you have a problem. So one is consequences. It's causing negative issues in your life: health, financial, social, mental health. 2 is it's out of control. You say to yourself, you know what, I'm not going to drink over Christmas, or I have exams coming up, or I got a big work project, and you find that you still are doing it. The 3rd is what we call cravings. You know, you're having dinner with your kids, or you're on the bus and you have uncontrollable or a real urge to use. And then the last one is an inability to cut down. So despite your efforts to stop, you find that you keep going back to it.
Who is most susceptible to an addiction? Is it more a thing regarding genetics or external factors of extreme trauma or events that happen in your life?
It could be either or, or all of the above. Genetics is really important. So addiction is, we consider it a multifactorial condition. So it does run in families, and the stronger it runs in families, the more you are at risk. But it's just like diabetes. Even though there's lots of diabetes in your family, if you have a lifestyle that doesn't put you at further risk, you may not ever show diabetes. So same thing with addiction. And on the other hand, if you have no family history, but you are exposing yourself to drugs and alcohol, especially at an early age, it can happen to you. So it's kind of across the board. So
let's look at this on 2 levels. For a person that may be battling the addiction, what are the first few steps in terms of overcoming this obstacle? Because it's clear this isn't a short-term ailment.
Right. I mean, actual addiction, once it gets to the point where the consequence is out of control and you can't cut down, now we call it a disease. And it's the first step really is recognizing it. And even in general health, people don't recognize diabetes, they don't recognize heart disease until something big happens. So I think for average people, just to check in and ask themselves, what's their relationship like with substances? People I speak with always say that there's always an initial attraction. You know, I smoked because it relaxed, I drank because I was wittier at a party, I used marijuana because, you know, it helps me chill out. There's always an initial attraction, and what happens is the consequences creep in and the out of control use creeps in. So really just paying attention to your relationship with the substance and when it crosses from recreation to out of control.
And I know there are specific programs to support people who are battling the addiction. On the other side, when we have family and friends that are trying to intervene and trying to help, and I mean, in the Corey Monteith story, a lot of the sentiments being shared were that they knew he faced his demons and they tried to support him. What is the best way to support someone facing an addiction? Yeah, in a really serious addiction, I see it like no different than a cancer. You really have to be so mindful of your lifestyle, so aware of the triggers out there, having a support, a group of people who kind of know that you're at risk and are around you. That's really important. And just to stay connected and to just recognize that once it's to that point where it's been such a severe detriment to someone's life, that they are at risk of relapsing. It is a lifelong condition. And any quick advice to the parents that may be watching for their children, anyone that they know of the signs to intervene immediately to avoid any extreme circumstance?
Yeah, I think parents are intuitive. You know, a lot of times they get a feeling, but sometimes they may not act on it. So if you're suspicious, you're worried about your child, you've seen a change in their behavior, they're just not the kid that you know, the most important thing is to try to make a connection and come from a place of empathy and say, look, you know, I was a kid one day too, there's a lot of pressures, it's tough, how are you doing, is there anything going on, is there anything you want to talk about? Start open-ended, because when you start open-ended, you'd be surprised what the person says back to you. And we want kids to say what we're dying to say. We want them to say, you know what, I'm wondering, you know, if I did too much, or if I was thinking of trying something at this party. So really being open and coming from a place of empathy. That's really tough for parents because they are worried and they want to come from a place of control and authority. But especially as a young person gets older, really kind of taking a place as a teammate. I'm your coach, I'm with you on this. I can accept what you're doing. That doesn't mean I will approve of it. Acceptance doesn't mean approval, but I'll always guide you in the right direction.
Such valuable insight on this topic. Dr. Shimi Kang, thank you so much for joining us on this. DrShimiKang.com is the website. There you go, right there to find out more information.